Hi, everyone. Welcome back to the Remedy Pharm Health Minute. This is Amina, your pharmacy manager here, certified hormone specialist. Today, I have a guest interviewer, Dr. Kamil. She's board certified in internal medicine and here to talk to us a little bit about the coronavirus. Hi, Dr. Kamil.
Hi, Amina. Thanks for having me.
No problem. So thank you for being available to, talk to our community about coronavirus or COVID-19. I just wanted to kind of get into some facts about it, what the social distancing is all about, what you're doing at home and at work to try and, minimize the impact and what people can do at home as well. So let's get started.
Good.
Okay.
All right. So, there's a lot of stuff around the news that's going on. So just a couple of basic facts. COVID-19 or coronavirus disease 19 is, it's an infection caused by a virus. It started kind of sometime late last year and now has spread to a global pandemic. How it basically works is it's spread by droplets. So you think of an infected person, they sneeze or they cough. These droplets somehow make their way to a regular uninfected person, get into their lungs and can cause an infection. Similarly, if these droplets are on a door handle, on someone's hands, and you shake that hand or touch the door handle and then touch your face, it's another way of these droplets getting into your system. And then the time in which these droplets get into you to when they actually start to cause the symptoms is what we call the incubation period. And what's important is during this time, the uninfected person can continue to spread this to regular people, even though they aren't feeling sick at all. The symptoms that we've all heard about are things like fever, cough, difficulty breathing, and about 20% of the population, it can cause things like pneumonia, and in pretty bad cases, respiratory failure. And social distancing is pretty important because common sense dictates if you have an infected person, just keeping them away from regular people until their disease course runs its way and they become healthy again, to stop them from spreading it to regular people, and then those people continuing to spread to others, which is why it is spreading so quickly with cases rising day by day.
Wow, that's amazing. So question for you, how about like the flu virus? People are talking about the SARS, the MERS. How is this one different if it's a viral infection?
So it's been compared to influenza, and which is why, most of us weren't taking it seriously at the very beginning. So influenza, depending on the year, has a mortality rate between 0.5 to 1%. This particular virus is between 3 and 4%. So you think of every 100 people, and I'm sure everyone knows 100 people, this virus could kill 3 or 4 of them, as opposed to 1 in the case of influenza.
Oh, wow. Okay. How about you at the hospital? I'm sure where you work, you're being affected by this. Do you have any, are you guys overwhelmed? What's your staff thinking of? What's going on over there?
So I think a lot of us are comparing, ourselves to Italy, and that we are probably going to be the same situation that they are maybe 2 weeks from now. And so we're having a lot of preparations. Of course, it hasn't gotten bad just yet. I think we're all saying that we're at the calm before the storm, and this is pretty. We're making our preparations in terms of canceling all of elective procedures, reducing visitors, people who aren't very sick, getting them out of the hospital sooner than later, things like that.
Oh wow, okay. So there's a lot of questions about the testing and who's going to get tested and what's going to be the availability of a test. Do you have any idea about that or any information?
So unfortunately, that depends on every facility. I've heard testing can take between 6 hours to 6 days in some facilities. And, a lot of that is not under our control in terms of who can get tested and who can't get tested. There's a limited number of tests that's available to the public health department. And so unfortunately, we are unable to test as much patients as we can. So the true number is probably underreported.
Oh, wow. Okay. Are the tests, is that like another blood work, or is it a different type of sample that they use for it?
So it's a swab. So basically, we swab the nose of patients that we think may have been exposed or have showing symptoms. get some of the cultures from the inside of the nose. It's pretty deep, but it's like, think of a little, how do I say it? It's maybe like a cotton swab or something that looks like that, but much longer,
Mm-hmm.
and pull out some of the cultures from the deep through the
Okay.
nostril, and then that's sent to the lab to process. And they look for what we call PCR, so the genetic sequence that is seen in coronavirus, to see if that is able to be replicated.
Oh, wow. Do we have any hope right now, or is there any talks about a cure or vaccine in the works? Have you heard anything on your side?
So I know there's nothing FDA approved at this time. They're doing a lot of trials. There's some promising data in, China and South Korea. So it's all very new. I know there's like sort of talk of vaccine, but nothing official just yet. There's a couple of things that are showing promising thoughts. So we'll see. This is probably in a month we'll maybe know more. But for a true vaccine, it's probably going to take lots of testing and maybe several months to a year.
Wow. I had another question for you. What about like your staff at work? How are they handling it? Is there any way that anything you're doing specifically to ensure their safety, or vice versa? And then what are you doing at home? I'm sure you have a family as well that you need to take care of.
Yeah, definitely. So, my patients are all, most of my patients, who are here currently are very old, 80s, 90s, severely immunocompromised. And so it's definitely very important for me, going from one patient to another patient, that I take extreme precautions in protecting myself as well as my patients in terms of transmitting this disease. So, hand hygiene, which is what everyone's been speaking about, using gloves, masks, definitely wiping down stethoscopes before and after use to prevent this transmission of infection. And then, of course, coming home, doing the same thing as well. Just being extra precautious. And, healthcare workers are definitely more at risk for contracting this, just because we get exposed to it so much and we don't know who has it and who doesn't. So, and that's also part of it, not trying to overwhelm the emergency room, since we're already seeing a lot of cases so far.
Wow. Yeah. A lot of questions that I've been seeing is that with the whole social distancing thing, people are asking if you want us to stay in our house and be in quarantine, how come we're allowed to go to the grocery store or the pharmacy? Can you speak on that a little bit?
So yeah, definitely. I mean, there's some essential things, of course. Groceries, food. Not everyone can live off, enough canned food and whatnot for how long this quarantine is going to last. So of course, grocery stores are important. Just keep them limited. Pharmacies for picking up medications. Those are also important things. So just being wise about how you choose to spend your time outside the house, and running essential errands. And when you do go, keeping it very limited, the interaction you have. And then, of course, once you come back, washing hands, wiping down anything that you think you may have touched, and being careful about that. I think social distancing, you can still go for a walk, for a hike. Again, just stay like at least 6 feet away from people and avoid
Mm-hmm.
large gatherings.
Okay, that sounds good. Trying to think if I have anything else I want to ask you, but I guess for people at home, they can just, like you said, practice hand washing, take your shoes off. I'm sure, how about changing your
Mm-hmm.
clothes when you enter,
Exactly.
stuff like that. Just any kind of precautions that you can possibly take, right? And I'm sure a
Exactly.
lot of places are saying that if you don't feel well, don't go into work. That
Exactly.
brings me to my next question was actually,
Mm-hmm.
how about everyone who's been getting those face masks? Now the new reports are saying that if you're asymptomatic, you can still be spreading the disease. So should we all
Mm-hmm.
assume that we have the virus and we're asymptomatic and just cover our faces, or how does that work?
So, and that's why social distancing comes into play, where, you're isolating yourself from many people in the event that you could be potentially exposed. Masks, while they mostly help if you are infected and you're not coughing up droplets that are spreading, so the mask will be a barrier for that.
Hmm.
Um, so I definitely don't think masks is practical for everybody to wearing it. We're already having shortages, in the hospital itself, where our own healthcare providers don't have enough, just because there's been a national shortage
Right.
of masks. So, if you're sick, yes, wear a mask. If you're maybe immunocompromised, wear a mask when you go outside. But I don't think regular wearing of masks has been shown to, reduce anything any better than hand washing and staying 6 feet away from people and all that other hygiene stuff.
Okay. Thank you so much, Dr. Kamil, for all the time you spent with me today and answering these questions that a lot of people have been asking and wondering in the community. I'm really excited to share this with everyone, and thank you so much for your time.
No problem. Thank you.